Hi, I'm Dr. Nicolai Lennox, and I'd like to talk to you about the thyroid. The thyroid gland lives right about here, and it's a very fascinating gland. You know, what it's really involved with is the idle speed. We all know about adrenal glands. We've all heard about thyroid glands. The adrenal glands are like your accelerator pedal. Well, the thyroid gland is like the idle speed. It's that sort of basic metabolic rate that sets up in your body. And what happens is that a lot of things affect thyroid function. And as a result, we may find ourselves underfunctioning in ways that we just don't identify as being related to the thyroid. So what I want to talk about then is how to identify hypothyroid in the subclinical fashion, not the clinical pathological version. The pathological version is generally diagnosed by your medical doctor. I would specialize more in looking at the subtle versions of the thyroid. You may have perfectly normal lab tests. Your medical doctor may do a thyroid test, a thyroid stimulating hormone or TSH test, and it may fall within normal ranges. But what I'm here to tell you is that there's another way of looking at that that will give you a better service in helping you feel better and be healthier. So, when we think about the thyroid, we forget sometimes that it's related to so many different kinds of moods. One of the things that people always forget is that when your thyroid is hypofunctioning or low functioning, your cholesterol tends to go up. So surprisingly enough, you would think that everybody would test thyroid when you have higher cholesterol. But in fact, that's never done. And so one of the first things you always think about with a cholesterol issue is, how's the thyroid functioning? Is it classically low, or is it functioning low as a result of some other features? So another thing that we think about with thyroid is that thyroid's tremendously involved with moods and attitudes. Pretty much every single case of depression, you really have to take a look at the thyroid, because the thyroid is involved in physiological depression, and therefore if you have a physiologically depressed state, you'll have an emotionally depressed state. There are some 3 or 4 rather classical emotions that we identify with thyroid. One is that wonderful state of feeling where you just don't feel attractive no matter what. You just feel like you're unattractive, and your loved ones, your friends, your families, they just cannot convince you that you're attractive. You could even go so far as to see a photograph of yourself and say, oh, that's a very attractive looking person, until you know that it's you, and then suddenly that sort of clicks in. And that's not an emotional event so much as it's a result of thyroid hormones being off. Another one is wanting to be left alone. I want to be left alone. I don't want you to touch me. I don't want you to talk to me. I want you basically to give me my space and leave me alone. And at the exact same moment, there's this feeling of, well, why are you never there for me? Why are you never there for me when I need you? It's that sort of paradoxical state. And one of the more classical ones is tears come out of my eyes about stuff I'm not sure I really care about. You know, sometimes you'll watch an emotional, sentimental commercial and tears come out of your eyes, and you don't even care about the product. But if there's something really worth crying about, then it's unstoppable. And a few of you may recognize these as being part of what we commonly associate with a premenstrual syndrome. So one of the things that's good to know about thyroid is that thyroid is suppressed by estrogen. So that means that in the premenstrual time, when the estrogen is surging and perhaps the liver isn't breaking down the estrogen properly, or perhaps there's some B vitamin deficiency syndrome, who knows what's going on, but the higher estrogen will suppress the thyroid and give those classical thyroid symptoms. And these are things that we need to be aware of, and things are so easy to fix if you understand the mechanism of what's going on. The other thing that happens is, of course, thyroid is classically involved with weight gain, inability to lose weight. And the other things people don't think about much is that thyroid is oftentimes involved with gallbladder symptoms, digestive systems, pains in the neck, pains between the shoulder blades that are all reflective of digestive stress. And so what we can do is, besides doing a more complicated lab test, classically what we do is people will do a TSH test, which is just this, used to be called the gold standard of thyroid testing. Unfortunately, the TSH does not reveal a lot of things about the thyroid. It's just a sort of a one glimpse. You could even have looking at your T3s and your T4s. I know these are fairly technical numbers, but they do exist. And they could be within, quote, normal limits. But you might notice that one is high and one is in the low normal. And you must admit, even if it's within normal limits, If it's toward the upper limit or toward the lower limit, that's not what we call optimal function. And if you don't have optimal function, then you're going to experience that you don't have optimal function. Another thyroid symptom you may be interested in, of course, is this feeling of just never getting quite enough sleep, feeling that you wake up in the morning and you haven't had enough rest. You sort of wake up in the morning and you go, that's it? That was my sleep? That oftentimes is combined with a sort of a sense of insomnia, difficulty resting at nighttime. So these are the kinds of things we want you to be able to pay attention to that we deal with in natural medicine. These are nutritional things we can work with. These are dietary things we can work with. These are things that fall within the realm of natural medicine because they are subclinical. They're not classical pathological events, but they're what we call subclinical hypothyroid. And you can look up on the internet and you can see a whole list of symptoms you would probably identify with. What I want to caution you about is this. If you go on the internet and you look at all the things that you should do about hypothyroid, what you're going to be doing is you're going to be using a formula to fix your individuality. And this is the difference between an individual practice where you're dealing with a doctor who can read your body and relate to your body, and just taking formulas off the internet that should work. It's like a bell curve event. You know, the bell curve has this wonderful curve, and in the middle of that range, everything's perfect. But on the outside of the ranges, things don't work so well. And that's how we get reactions to medications and reactions to nutritional supplements. If you're that person that is designed for that mid-range bell curve person, you always have this great success. But what we find in the clinical practice when we have patients coming in, those are the patients who have not responded to those things. And they need an individualized, one-on-one, one doctor looking at one patient and listening to their body carefully through muscle testing, through a proper history, and then we can find the right kind of solution for your body. So that's a little short view of thyroid, and what you want to do is evaluate yourself, and if you have the kind of situation that responds to this, then come on in, let's take a look at it, see if we can help you out. Thank you.